Hello, and welcome to the HRA Regulations webinar. We're going to be talking today about new opportunities that have been provided through final regulations, which will be available in 2020. My name is Kim Wilcoxon. I'm a partner here at Thompson Hine. And today, what we're going to do is first sort of talk about the two new types of HRAs. So a broad overview of what it is that the regulations created. And then we'll compare those new types of HRAs to the HRAs that employers currently know and love or not love to determine what type of employer might be interested in exploring one of these two new types of HRAs. And then, because this is obviously a concern on many employers' minds, a discussion of how offering these HRAs may satisfy or not satisfy the ACA employer mandate. Then we'll go through a few additional considerations that an employer might want to be aware of when deciding to use one of these new HRAs. And then finally, once we go through all of that, and we'll go through the requirements for actually establishing and maintaining each of the new types of HRAs. I've given a lot of information in the slides, which are available here on the webinar through the handouts. You should also have received a copy through an email earlier today. If you don't have those slides, don't know how to get them, and have any questions, please feel free to send your question through the chat feature of the webinar. Additionally, if you have questions as we go along, you can submit it via the chat feature, and I'll take questions throughout if that makes sense, or if not, at the end of the presentation. So to begin with, let's do an overview of the new types of HRAs. As you're probably aware, President Trump in October of 2017 issued an executive order instructing the IRS and related agencies to make it easier for employers to use HRAs. In response to that, the agencies issued regulations, which were initially proposed and then finalized June 13th of 2020. And this will be effective for plan years beginning on or after January 1, 2020. The first type of HRA that's an option under these new regulations is an individual coverage HRA. Some people refer to these as ICHRAs. An individual coverage HRA allows employees to use non-taxable employer contributions to purchase individual insurance. And when I talk about individual insurance, what I mean is insurance that's purchased outside of an employer. So it's purchased on the individual market. An individual could purchase insurance for himself and his family, and that would still be considered individual insurance, even though it's covering more than one person. So when we talk about individual insurance, we mean on the individual market as opposed to the group market. So the individual coverage HRA can reimburse premiums for individual insurance, but it can also reimburse any other medical care expense under the definition of Code Section 213D. Now, an employer has the ability to sort of pick and choose what types of expenses will be permitted under the HRA. So, for example, the employer could say that the HRA is available only for the individual insurance premiums. They could say only for individual insurance premiums plus cost sharing required under the policy, or could be any 213D medical expense. That's a plan design issue for the employer who's offering the ICHRA. Now, sort of the key here is that an employer who offers an ICHRA may not also offer a traditional group health plan to the employees who are eligible for this type of HRA. And the HRA must be offered, and generally must be offered on the same terms, to all members of a permitted class. What do we mean by this? An employer could say that all employees are eligible for the ICHRA, meaning that none of the employees would be eligible for a traditional group health plan. Or the employer could say full-time employees are eligible for our traditional group health plan, whereas part-time employees are only eligible for the ICHRA. So the employer can't pick and choose which employees are eligible for the group health plan and which are eligible for the ICHRA, except along these lines. So for example, if you had a retail employer, the retail employer could not say corporate employees are eligible for our traditional group health plan, but store employees are eligible only for the ICHRA. That's not a distinction that's being drawn here in these permitted classes. But the employer could say that salaried employees are eligible for the group health plan and non-salaried employees are eligible for the ICHRA. The other type of HRA that's provided under these regulations is an accepted benefit HRA. When we use the term accepted benefit, what we mean is that there's a list of benefits that have been accepted from certain requirements under the law. And a benefit that's an accepted benefit is not subject to the Affordable Care Act's market reform rules and certain other requirements. An accepted benefit HRA is an HRA that is considered an accepted benefit under the rules. Now, that's different from an HRA that reimburses only accepted benefits. So let's give an example. Accepted benefits may include accident-only coverage, or limited scope dental coverage, or hospital indemnity, or cancer insurance. These types of non-major medical health coverages are accepted benefits under the rules. An HRA that would reimburse only premiums for those types of accepted policies wouldn't be subject to anything we're talking about today. An accepted benefit HRA is an HRA that is also an accepted benefit, but it's not limited to reimbursement of accepted benefits. And I'm sure that's all very confusing. So let's go through an example. An accepted benefit HRA could reimburse premiums for COBRA. COBRA premiums are not accepted benefits, so an HRA that reimburses only accepted benefits could not reimburse COBRA premiums. This one can. So an accepted benefit HRA can reimburse Code Section 213D medical expenses, but can't be used to reimburse premiums for individual health insurance, group health plans, or Medicare. Now, there are some minor exceptions to those rules, but that's sort of the big idea. And in order to offer an accepted benefit HRA, the employer must offer a traditional group health plan to employees who are eligible for this type of HRA, but they don't have to integrate it. And an accepted benefit HRA, which doesn't say on this slide but will later on, is limited to only $1,800 per year. So it's essentially a limited pot of money that an employee can use to reimburse them for standard medical expenses other than insurance premiums. So let's compare this type of each of these types of HRAs to the HRAs that we already are familiar with. So the first type of HRA would be a group health plan integrated HRA. So a group health plan integrated HRA is our traditional health reimbursement arrangement that back in 2013 we learned needed to be integrated with a group health plan in order to comply with the Affordable Care Act. So any employer can offer a group health plan integrated HRA. But the employer must offer a traditional group health plan in addition to the HRA. Now, there are no specific requirements for who needs to be eligible for this HRA, but it is a group health plan, so the non-discrimination rules apply, which means we couldn't discriminate against an individual based on their health status, and the 105H rules apply, which means that we can't discriminate in favor of highly compensated individuals. So sort of our general rules apply, but no specific rules apply about who we have to offer this HRA to. The HRA is fairly flexible in its amount. The dollar limit can be set by the plan sponsor, but the HRA cannot be used to reimburse individual insurance premiums. And that's the problem that then led us to the regulations we're talking about today. Another type of HRA with which employers may already be familiar is a retiree-only HRA. Any employer can offer this type of HRA, and there is no requirement to offer any other coverage along with this. This HRA does not have to be integrated with anything. However, it can't cover more than one current employee. It really is limited to retirees, or if you had an employer that had only one employee, that could be offered, but not more than one current employee. The dollar limit can be set by the plan sponsor, again, some flexibility there. And this one can be used to reimburse individual insurance premiums. Of course, the problem with this one is it can't be offered to your suite of employees. Then we have the QSERA, which was developed to assist small employers in allowing their employees to pay for individual insurance. The problem with the QSERA is that it can only be offered by non-applicable large employers, so employers with fewer than 50 full-time employees. And an employer cannot offer health coverage along with the QSERA. It has to be only the reimbursement account. And it has to be offered to all employees with certain limited exclusions and no former employees. The amount that can be used to reimburse is limited by law, but it can be used to reimburse individual insurance premiums. So it's sort of a limited opportunity for small employers to reimburse individual insurance premiums rather than offering a group health plan. Extremely limited, though. Contrast that with our new opportunity here with this individual coverage HRA. So any employer can offer the individual coverage HRA, but the employer may not offer a traditional group health plan to employees who are in the same class as employees who are eligible for the ICHRA. The individual coverage HRA must be offered to all members of the eligible class. The dollar limit is set by the plan sponsor, so we've got some flexibility on amount. And the whole purpose of this is that this ICHRA can reimburse individual insurance premiums. So looking at this comparison, what type of employer might be interested in an ICHRA? Well, a smaller employer who can do a QSARA but doesn't want to because maybe they want to offer a larger reimbursement amount than the QSARA would provide. Or maybe they want to limit the employees who are eligible for the reimbursement account. Under the QSARA, all employees have to be offered the account. Under the individual coverage HRA, we can pick and choose classes that are offered. Additionally, larger employers who can't offer a QSARA but who want to allow some or all of their employees to purchase individual coverage might be interested in this. Or larger employees who want to satisfy their ACA obligations without actually providing a group health plan, or maybe not providing a group health plan to certain employees. Think staffing agencies. Prior to the Affordable Care Act, some staffing agencies said, well, we're going to offer health coverage to our corporate employees, but the temporary employees that we send out on placements are not eligible for our health coverage. The Affordable Care Act came along and strongly encouraged those staffing agencies then to offer health coverage to their temporary employees. They could use this individual coverage HRA rule as an opportunity to cease offering the traditional group health plan to their contract temporary employees and instead offer them an ICHRA, which they could then use to buy coverage on the open market. And going back to the permitted classes, the temporary employees are considered a class. So staffing agencies have a special rule that would allow them to distinguish between their temporary employees and their corporate employees. So what about the accepted benefit HRA? So the accepted benefit HRA, can be offered by any employer, but the employer must offer a traditional group health plan. The accepted benefit HRA must be offered to all similarly situated individuals as provided under HIPAA. And again, it's limited in amount to the $1,800. And the accepted benefit HRA, unlike the ICHRA, can't reimburse individual insurance premiums other than short-term limited duration insurance or individual coverage that provides just accepted benefits. So an employer who might be interested in this type of HRA is probably just an employer who wants to offer a pot of money to its employees to reimburse medical care expenses without having to go through all the hassle of integrating it with another plan. So for example, with an accepted benefit HRA, an employee wouldn't have to be enrolled in the employer's health plan or any other health plan in order to use this money. And then I put a chart here on this slide to sort of show how these types of HRAs relate to one another with respect to certain compliance obligations. So just because you offer an individual coverage HRA, that doesn't mean you're exempt from certain ERISA obligations. So the individual coverage HRA and the accepted benefit HRA are both group health plans. So like the integrated HRA or the retiree only HRA, they're going to be subject to COBRA. They're going to be subject to the HIPAA privacy and security rules. Although the HIPAA privacy and security rules do not apply to plans that are administered by the employer and have less than 50 participants. So if you're working with a small employer that has less than 50 participants and they're self-administering the reimbursement account, they wouldn't have to worry about the HIPAA privacy and security rules. But otherwise, the individual coverage HRA and the accepted benefit HRA would be subject to those rules. These new HRAs do still require a plan document and an SPD. The individual coverage HRA actually requires an SBC, although the accepted benefit HRA does not. And the individual coverage HRA is minimum essential coverage, meaning that an individual could use that to satisfy the individual mandate in states that require minimum essential coverage. It could also be used to disqualify the individual from the premium tax credit. So an individual who is enrolled in minimum essential coverage is not eligible for a premium tax credit to help pay for an ACA marketplace policy. So the individual coverage HRA could disqualify someone from a premium tax credit. The accepted benefit HRA could not. Then I want to talk just a minute about possible combinations. So an employer can offer multiple HRAs at the same time. So an employer that offers a group health plan integrated HRA could also offer a retiree HRA, could also offer an accepted benefits HRA, could also offer an HRA that reimburses only accepted benefits. Those can be offered in connection with one another. But if an employer is offering a group health plan integrated HRA, they could not offer a QSARA or an individual coverage HRA to the same class of employees who has the group health plan integrated HRA. And the reason for that is the group health plan integrated HRA, remember, requires an offer of health coverage. And neither the QSARA nor the individual coverage HRA permit the employer to offer the traditional group health plan. An employer that offers an individual coverage HRA could also offer a retiree HRA or an HRA reimbursing only accepted benefits, but could not offer a QSARA, a group health plan integrated HRA, or an accepted benefits HRA. And then an employer who offers a QSARA could also offer a retiree HRA, but could not offer any of the integrated HRAs or the accepted benefits HRAs. So that's a run through to sort of give you a high picture of the types of HRAs that are now available, when an employer might be interested in offering one. But an employer who is interested in offering one likely is going to have questions about what this means for their compliance with the employer mandate. So a quick refresher on the employer mandate. Code section 4980HA applies a penalty to an employer that offers coverage to less than 95% of its ACA full-time employees if at least one of the ACA full-time employees purchases a marketplace policy and qualifies for a premium tax credit. So an employer in that situation would be subject to a penalty of approximately $200 per month times the full number of ACA full-time employees employed by the employer, regardless of how many of them are enrolled in coverage, regardless of how many of them are eligible for coverage, regardless of how many of them get a premium tax credit. The A penalty, sometimes referred to as the sledgehammer penalty, applies to every full-time employee no matter what. It only takes one full-time employee to get the tax credit in order for this sledgehammer penalty to apply. The 4980HB penalty, by contrast, applies when an employer does offer coverage to at least 95% of its ACA full-time employees, but the employer doesn't offer affordable minimum value coverage to at least one ACA full-time employee, and an employee who doesn't get an offer of affordable minimum value coverage gets a premium tax credit. In that case, the penalty is going to apply based on each person who gets the tax credit rather than to the workforce as a whole. So the 4980HB penalty is much more manageable than the 4980HA penalty, which is why it's good news to hear that an employer that offers an individual coverage HRA is considered to have made an offer of coverage under 4980HA. So an employer who chooses not to offer a traditional group health plan to any of its employees can offer an ICHRA and still be considered to meet the qualifications under the 4980HA and avoid that sledgehammer penalty. So the key then is, when is an individual coverage HRA considered to be affordable and minimum value? We don't know yet, I guess is the way of saying that. We have a notice from the IRS, Notice 2018-88, which proposed a safe harbor method for determining affordability. And what the guidance has told us is, if the HRA is considered affordable, it will also be considered to have provided minimum value. So we don't have to worry about the minimum value issue. We're only worried about affordability. Treasury and the IRS do plan to issue proposed regulations on this, but what we're hearing is that the determination likely will be similar to the affordability determination for the premium tax credit, which was included in the regulations we just received. So we've got a picture of what this might look like. Now, an individual who actually is covered by the ICHRA will be ineligible for the premium tax credit. As I mentioned just a minute ago, an individual who's enrolled in minimum essential coverage is not eligible for the tax credit. If the individual is eligible for the HRA, but opts out of it, then the individual is considered ineligible for the premium tax credit only if the HRA is considered affordable. And the HRA is considered affordable if the employee's required HRA contribution does not exceed 1/12 of the employee's household income times the required contribution percentage. So essentially, what we're looking at here is what the employee would have to pay for individual insurance coverage above and beyond what they get from their HRA. The required HRA contribution is equal to the monthly premium for the lowest cost silver plan. So we're not actually going to look at what coverage the individual enrolls in. We have a standard that we're able to use for this determination so that if someone enrolls in a higher or lower cost plan, that's not going to impact the affordability of the HRA. But so we look at the lowest cost silver plan in the marketplace for the rating area in which the employee resides, and we subtract from that the amount made newly available to the employee for self-only coverage for the year, divided by the number of months in the year that the HRA is available. And then the required contribution percentage is the same that it is for any other affordability calculation. It's 9.56% as adjusted for inflation. So it was 9.86% for 2019. For 2020, they just announced that it's going to be 9.78%. So let's look at an example to show how this works. And I'm going to try something tricky here. So let's say an employer's self-only contribution for a plan year is $3,000. The employee's household income is $20,000. The employee is enrolled in the ICHRA for the full calendar year. The monthly premium for the lowest cost silver plan is $400, and the required contribution percentage is 9.86%. So the employee's required HRA contribution cannot exceed 1/12 times the employee's household income times the required contribution percentage. So the employee's required HRA contribution is equal to the monthly premium for the lowest cost silver plan minus the amount made newly available. In our example, the lowest cost silver plan premium is $400. The amount made newly available is $3,000. So that gives us a number of $150. So that $150 cannot exceed 1/12 of $20,000, which is the employee's household income, times the required contribution percentage, which is 9.86%. So when you do the math, that brings you to a total of 164.33. And we see that 164.33 is larger than 150. So this particular ICHRA would be considered affordable for purposes of the premium tax credit. An individual who was eligible for this but opted out would not be eligible for the premium tax credit. Now, for an employer mandate perspective, it may be difficult to plan ahead of time for this type of calculation because the employer may not know far enough in advance what the cost of the lowest cost silver plan is. And the employer may not know, honestly, where the employee lives. Sometimes employees move from place to place. They don't update their address. So it's hard to tell what rating area the employee is going to be living in. So the IRS has given us a sort of a safe harbor proposal. And under this safe harbor proposal, the HRA will be considered affordable for employer mandate purposes if the same calculation applies, but we get to use the prior year's monthly premium so we can plan ahead. And we get to use the employee's worksite location because that's something that the employer definitely knows. So under this calculation, an employer that offered this ICHRA could spend $3,000 per individual per year and still satisfy the employer mandate requirements of an offer of affordable coverage. Given the cost of a traditional group health plan, that's not out, completely unreasonable. But what happens when we look at an employee whose income is higher? So this is for a very low income employee. When you look at a higher income employee, what you'll see is that the employer's required contribution actually goes down. Because remember, the key is what can the employee afford to pay for a policy above and beyond what the HRA provides. So under the calculation here, the cost of the policy does not change. The cost of, or the amount of the compensation changes. which then as the compensation increases, the number on this side of the equation increases, which means that we can increase the number on this side of the equation, which means that the contribution can be reduced. So as the income goes up, the required contribution actually goes down, which again is good news for employers. A few additional considerations to address for employers who may be considering this. One is the application of ERISA. Whenever an employer pays for medical care for their employees, it's considered a group health plan, right? And so when the employer is giving money to an employee to purchase health coverage, there's a risk that that health coverage they purchase could be considered a group health plan. And so the Department of Labor has given us a safe harbor that's similar to the safe harbor we currently have for voluntary group policies. So essentially, if the employer provides that the purchase of individual insurance is completely voluntary, the employer doesn't select or endorse any particular insurer, the reimbursement is limited to individual health insurance coverage that does not consist solely of accepted benefits, the employer doesn't receive any consideration in connection with the selection, and each plan participant receives an annual notice, then the policy that's purchased using the funds from the HRA will not be considered subject to ERISA. So an employer who's considering an ICHRA will just need to make sure that they structure their offering in the right way to keep those policies exempt from ERISA. Now, the nice part about the guidance that we got here is that this rule doesn't just apply to ICHRAs. It also applies to QSARAs, retiree-only HRAs, other HRAs that are offered to fewer than 2 current employees, and cafeteria plans that allow employees to pay for the portion of the individual insurance premiums not covered by an HRA. So if you're working with an employer who has some other mechanism to allow employees to purchase individual policies, they can follow this safe harbor and keep the policies outside of ERISA. Now, one quick note here that was an issue in the proposed regulations and the final regulations is that we learned that an employer can use a cafeteria plan to allow an employee to reduce their pay on a pre-tax basis to purchase an individual insurance policy, but it has to be outside of the exchange. So if an employer is offering a reimbursement account to pay for part of a policy, an employee can reduce their pay on a pre-tax basis to pay for the remainder of the policy, but only so long as that policy is purchased off an ACA exchange. An additional consideration is the impact on an HSA. You can have an ICHRA that is a limited purpose ICHRA, a post-deductible ICHRA, or a combination limited purpose post-deductible ICHRA, just like our current HRAs and FSAs. So if we offer a limited purpose and or post-deductible individual coverage HRA, that won't disqualify the employee from contributing to an HSA. If it's a post-deductible HRA, though, it's the employer's responsibility to make sure that the reimbursements aren't provided before the employee satisfies their deductible. And if it's a limited purpose HRA and it permits reimbursement of premiums, it won't disqualify the employee so long as the employee uses that money to purchase a high deductible health plan policy. If the individual uses that money to purchase a PPO that doesn't qualify as a high deductible health plan, well, then the ICHRA would also disqualify the individual. So in that case, the individual has already been disqualified and wouldn't be able to contribute to an HSA. But keep in mind that you can design these things to be compatible with HSAs. And then last but not least, an employer may be thinking, well, there's really no reason for me to add one of these things before the beginning of the next year, because the individual marketplace has a special, an annual enrollment period. If I put one in now, what good does that do to my employees? Well, employees will have a special enrollment right to get into the individual market when an employer first starts to offer an ICHRA. So that is something that the employee, it's something special because the employer started to offer the ICHRA, then the employee can purchase a policy in the individual market. It also applies, if the employer has already established the ICHRA, but the employee first becomes eligible for it. So when the employee first becomes eligible for the ICHRA, they will have a special enrollment right to get into an individual market policy. And that brings us to requirements for the individual coverage HRAs. There are a lot of them. And before we get into what those requirements are, it may be helpful to understand why they are what they are. What were the concerns that the regulators were trying to address when they wrote these rules? Now, they were instructed by the executive order to allow HRAs to be used in connection with non-group coverage. But that raises at least two issues. One being individual insurance market stabilization. So take, for example, this scenario one. You've got 1,000 individuals who each pay $100 in premiums to an insurance company. So the insurance company is taking in $100,000. Let's say only one of those individuals incurs any claims. They incur $25,000 in claims. In that case, the individual or the insurance company really does well. They have a net gain of $75,000. That's the kind of business they want to be in. Under scenario two, however, what if all of the individuals who have paid into the policy each incur $25,000 in claims? Well, in that case, the insurance company then has a net loss of $25 million. Definitely not a business that the insurance company wants to be in. So the concern here is if we have a higher percentage of people who are insured in the market that are generating claims, there's not enough premiums coming in. There's not enough people across which we can spread the risk. So when the higher percentage of insured persons incurred claims, the insurance company, has to raise premiums in order to make their business financially viable. When they do that, then healthier insureds drop out. They say, well, boy, this coverage is really expensive. I don't think I'm going to use it all that much. It would be cheaper for me to just pay for my own medical care. Why do I need this policy? They drop out, which then makes an even higher percentage of insured persons who are incurring claims, which then requires the insurance company to increase premiums even more, which causes more people to drop out. And this is what they call the death spiral. Eventually, the insurance company gets to scenario two, where they don't want to be in this business anymore. This is something that the regulators were really trying to prevent. How can we offer this type of benefit without leading to destabilization of the individual market? The other concern that they had is compliance with the law. The ACA market reform rules say that group health plans can't impose annual or lifetime dollar limits on essential health benefits, and that non-grandfathered plans must cover all recommended preventive care services and cover them all at 100%. Health reimbursements arrangements, by their nature, don't satisfy these rules. So if we are allowing employees, if we have to give employees the ability to do this, how can we do it in a way that complies with the ACA? These are the things that the regulators are thinking. So the first requirement to discuss is that participants, I guess I should back up. Let me give you an overview of what the requirements are, and then we'll dig into them in more detail. Basically, participants and any dependents covered by the HRA must be enrolled in individual insurance coverage that complies with the ACA rules on lifetime and annual dollar limits and coverage on preventive services. That's how the regulators are dealing with the concern on compliance with the ACA. So if we require the employee to be in a policy that satisfies the rules, then the HRA itself should also satisfy the rules. Second, the HRA must be offered on the same terms to all members of the same class. So we can't pick and choose based on health condition. We can't pick and choose based on the number of claims that are being generated. We need some sort of standard by which we can say these people get the ICRA and go into the individual market and these people don't. And that determination has to be done in a way that doesn't encourage employers to push their high-cost claimants to the individual market. In addition, initial and annual notices need to be provided, and participants must be given the opportunity to opt out of coverage annually and upon termination. This last issue gets to the premium tax credit that we just talked about, because if an employee is actually covered under the HRA, they're not eligible for the premium tax credit, and they may decide that the tax credit is more advantageous to them than the amount of money that's in the HRA. So, getting into detail, requirement to maintain individual insurance coverage. And as I mentioned at the beginning of this program, I may skim through some of these slides, but you've got some detail here. You can take it back and refer to it after the presentation if desired. So the requirement to maintain individual insurance coverage. An HRA must require participants and any dependents covered by the HRA to actually be enrolled. This requirement is not met if the participants enrolled in accepted benefits, like that cancer insurance, accident-only insurance, hospital indemnity insurance. That's not going to satisfy the requirement. Short-term limited duration insurance. That's a type of insurance that's offered only for a short period of time and doesn't have to comply with the ACA rules. So that wouldn't solve our problem here. And TRICARE also is not considered to be one of the policies that an individual can be enrolled in. All other coverage in the individual insurance market is presumed to be compliant with the ACA rules. So an employer does not have to evaluate each and every policy that their employees choose to enroll in. Note that there is no exclusion for coverage in states with the Section 1332 State Innovation Waiver. A state innovation waiver allows states to waive certain requirements of the Affordable Care Act. That won't have any impact here. There's no exclusion for catastrophic policies. If it's compliant with, it's in the individual market, even if it's a catastrophic policy, that's fine. There's no exclusion for grandfathered or grandmothered policies. Even though one of our ACA rules relates to, non-grandfathered plans, and this is a brand new plan, we can still integrate with a grandfathered plan or a grandmothered plan. And there's no exclusion for student health insurance. Any of those types of coverage would be permitted. Now, the individual coverage HRA can also be integrated with Medicare. We already have some rules on HRAs that are integrated with Medicare, but the ICHRA can be integrated with Medicare as well. So if an individual is not enrolled in individual coverage, then they must be enrolled in Medicare Part A and B or Medicare Part C. And you don't have to have the participant and all dependents enrolled in the same type of coverage. So you could have an employee who's enrolled in Medicare Parts A and B while the dependents are enrolled in an individual insurance policy. But all other individual coverage HRA rules would apply in the same manner. And we are expecting guidance to address how the Medicare secondary pay rule rules would apply in this case. Now, if an individual ceases, so they were enrolled in coverage to begin with, but then they drop out of it, any expenses incurred after the coverage ceases can't be reimbursed by the HRA. Now, you may be asking, well, there are certain cases where an individual retroactively ceases coverage. We know under the ACA that insurance companies can't rescind coverage except in the case of non-payment of premiums or fraud, misrepresentation. So let's say somebody has coverage that's terminated retroactively due to non-payment of premiums. The insurance company gave the individual a grace period. The individual is considered covered during the grace period. The individual fails to provide the payment on time, and so coverage is retroactively terminated back to the last date for which coverage was paid. In that case, once the HRA learns that coverage has been terminated, they cannot reimburse any expense that was incurred on or after the effective date of termination. But if they haven't been notified yet, and let's say the individual hasn't been notified yet that their coverage was retroactively terminated, the HRA can reimburse the expenses. So let's say, for example, coverage was terminated effective June 30. On July 15th, the individual submits an expense to be reimbursed by the HRA. The HRA reimburses it. On July 31st, the individual learns that their coverage has been retroactively terminated and notifies the employer. Well, in that case, the employer knows that the HRA has reimbursed an expense that was not eligible for coverage because the person wasn't enrolled in individual coverage at that time. But the HRA doesn't have an obligation to go back and recoup that. Their obligation is only going forward to make sure they don't reimburse anything that was incurred on or after the effective date of termination. And then if all covered individuals cease to be enrolled in coverage, then the participant forfeits the HRA. But note that loss of coverage under an ICHRA, because an individual ceased to be enrolled in individual insurance coverage, is not a loss of coverage that triggers COBRA. It's not a COBRA qualifying event. So an employer would not have to offer that employee COBRA under the ICHRA. Now, there's no requirement that an HRA cover all of a participant's dependents, but the HRA must comply with the ACA rules on coverage for children. So if we want to provide an offer of coverage, we've got to offer coverage to the children as well. If we offer coverage to children, we can't terminate coverage before they reach age 26. But there's nothing that says an ICHRA has to provide coverage for a spouse or for an adult child over age 26. And the HRA can be designed to allow the participant to exclude certain dependents. So they can give the participant the option. I don't want my child covered under this. Well, that's fine. And the child doesn't have to be enrolled in the individual insurance policy, but the child's expenses can't be reimbursed under the ICHRA. In addition to actually having coverage, the HRA must implement reasonable procedures to substantiate the fact that the individual has the required coverage. So an individual has to annually substantiate that they have individual insurance coverage, and with every reimbursement request must substantiate that they have individual insurance coverage. So how do you substantiate? For the annual substantiation, an employer could require a document from a third party, such as an explanation of benefits, an insurance card, a document from an exchange confirming that the individual completed an application and plan selection. These third-party documents can demonstrate that the individual is enrolled in individual coverage. But for the every reimbursement substantiation, or for the annual substantiation, the employer could require an attestation by the participant. And that attestation would include the date coverage began and name of provider. So you wouldn't have to have a third-party document, but you could with respect to the annual substantiation requirement. Now, the IRS was generous to us and gave us some model language, which we attached to the email that you got this morning and is available on the web function here in the handouts. So if you want to see what the model attestation language is, you can look there. The employer can establish the deadline for providing the annual substantiation. That's up to the employer, but it must be provided before the beginning of the plan year. Now, for somebody who was hired during the plan year or within 90 days before the beginning of the plan year, the employer can establish a separate deadline, but it's got to be prior to the effective date of coverage. And the annual substantiation must indicate that the individual coverage applies for the full plan year. If an individual is in an individual policy that has a different policy year and they know it's going to terminate in June, then that's not going to satisfy the requirement. And if the individual policy year doesn't match the HRA plan year, we can require the individual to attest that, yes, I will actually get that next coverage for the rest of the year. Now, the nice thing is the HRA and the employer can rely on the documentation or the attestation of the employee unless they have actual knowledge that the participant or covered dependent is not or will not be enrolled in individual health coverage. So there's no obligation for an employer to sort of dig behind the attestation and make sure it's correct. But if the HRA gains the actual knowledge, the HRA can't permit further reimbursements of expenses. And the HRA is considered to have actual knowledge if the HRA, the plan sponsor, or any entity acting in an official capacity on behalf of the HRA has that knowledge. So that was the substantiation requirement. That was the requirement to have individual coverage. Moving now to the requirement that coverage apply on class-based rules. An employer cannot offer the same class of employees a choice between the employer's traditional group health plan and the HRA. So the traditional group health plan does not include a plan that offers only accepted benefits or another account-based plan. So we're looking at major medical coverage, essentially. And the HRA not only has to be offered to everybody in the same class, but has to be offered on the same terms to everybody in the same class, with certain exceptions that we'll see in a minute. Now, it's important here to note when we talk about employers for purposes of the class-based rules, we're talking EINs. So if you have an employer that's a member of a controlled group, we don't lump together all employees of all members of the controlled group to determine whether we're complying with these rules. We look at each member on an individual basis. So to use the language of the ACA, an applicable large employer member is the employer, not the controlled group. So the HRA, although it has to be offered to all employees in the same class, doesn't have to also be offered to all former employees who used to be in the class. If the HRA is offered to former employees, they are treated as being in the class that they would have been in on the date of termination. And we don't have to offer it to everybody. So we could say we're offering this ICHRA to individuals who terminated employment with 20 years of service, or individuals who were age 55, or individuals who terminated after a certain date. So we don't have to offer it to everybody if we offer it to some, but we've got to offer it to them on the same terms as the other members of the class. Now remember, retiree HRAs are exempt from these rules, so we can have an HRA that's solely for retirees, different plan name, different plan number, different plan document, and it's not subject to these rules, so it can reimburse individual insurance premiums without falling for all of this. It's if you have former employees in the ICHRA that these rules are going to apply. Note that the rules do not establish minimum or maximum reimbursement amounts, as we noted at the beginning of the presentation, so the employer can set how much is available for reimbursement. But the amounts have to be determined on the same terms for every member of the class. Now, an HRA is not considered to be offered on the same terms if it's offered as the same percentage of the individual insurance policy. So you couldn't say that the HRA is going to reimburse 80% of the cost of a policy that this person goes out to the market and gets. It has to be a dollar amount. And that dollar amount, though, can be different depending on age or number of dependents. So for age, what you have to do if you're going to differentiate based on age is, number one, make sure the same maximum reimbursement amount applies to all employees of the same age. So everybody who's age 50 gets the same amount. Everybody who's over age 45 gets the same amount, whatever age bracket the employer wants to set. But the maximum reimbursement amount available to the oldest participant can't be more than 3 times the maximum reimbursement amount available to the youngest participant. So although the amounts can differ, they can't differ by more than 3 times. And so one question that an employer may have is, well, how do we determine age? Is it the age on the beginning of the year, on the date of the reimbursement, on the date the credit is provided? And essentially the employer has some flexibility just so long as the same method is used to determine for all participants in the same class, and it's determined before the beginning of the plan year. The maximum reimbursement amount can also differ based on the number of dependents covered. Again, so long as employees with the same number of dependents get the same maximum reimbursement amount. So an individual with 2 dependents gets the same amount as an individual with 2 dependents, no matter what the age of the dependents is, and so on and so forth. Now, when we talk about the maximum reimbursement amount that has to be offered in the same way to all members of a class, we can actually prorate that amount based on when somebody's hired during the year. So if the maximum reimbursement amount available to all 50-year-olds with 2 dependents is $5,000, we don't have to give $5,000 to someone who's hired in December. We can prorate that. Or the employer could use the number of dependents as of the first day of the plan year. They could use a reasonable proration method. There's some flexibility there. But in any case, the approach has to be the same for all members of the same class and has to be determined before the beginning of the plan year. Now, carryovers are permissible under an HRA. When we talk about the maximum reimbursement amount that must be the same, we're not including any amounts that are carried over from a prior year. So an individual who had $500 carried over and gets a new credit of $2,000, it's okay that we have another individual with no carryover also getting $2,000. The first individual will have a $2,500 account. The second individual will have a $2,000 account, but that's fine. We care about the new amounts made available. And so we're also not caring about any amounts that were transferred from another HRA. And you may be saying, we're allowed to transfer from HRA to HRA? And the answer is yes, under certain circumstances. So I've put some information on this slide about what HRAs can transfer to other HRAs. Note that you can offer employees in the same class a choice between an HSA compatible ICHRA and a non-HSA compatible ICHRA. The fact that employees choose one versus the other, that doesn't violate the terms, so long as the offer is made in the same way. And the timing of credits to the HRA must be the same for all employees in the class. The ability to use salary reductions to pay for the rest of that policy, is something that has to be offered in the same way to all members of the class. And we talked about the fact that cafeteria plans can't provide for the purchase of marketplace policies. Here again is our list of permitted classes. We're looking at full-time versus part-time versus seasonal. Folks who have not satisfied a waiting period could be exempted. We could do different for salaried and hourly. We can base it on the geography of the employment site. So these, again, were designed to be lines that are drawn based on objective factors and not that would allow an employee to shift people into a category that would then allow them to shift all their high-cost claimants to the marketplace. Now note, if you're using a full-time or part-time employee distinction or a seasonal employee distinction, you have a choice of defining full-time under the 105H rules or under the employer mandate rules. But it has to be done the same way. full-time and part-time have to use both use the definition under the ACA or under 105H. It's got to be chosen before the beginning of the plan year, and it's got to be included in the plan document. I've got some detail here on permitted classes. I'm going to let you read that afterwards. I want to just note that there is a minimum class size requirement in certain cases. It's not in all cases, but in certain cases, if an employer offers a traditional group health plan to at least one class of employees and offers an ICHRA to at least one other class of employees, and if the ICHRA is offered to salaried employees or non-salaried employees or full-time employees or anyone else on this list, then the group that's subject to the ICHRA has to meet a minimum size requirement. And I've provided some information here on these slides about how to determine the minimum size requirement. So let's go through some examples to sort of put these pieces together. You could have an employer that offered a traditional health plan to full-time employees and the ICHRA to part-time employees. In that case, though, the minimum class size requirement must be met. You could offer no traditional health plan whatsoever at all, but offer an HRA that excludes non-resident aliens with no US-based income. That's fine. The non-resident aliens is a separate class. We can exclude all the members of that class. We could have an employer that offers no traditional group health plan and offers an ICHRA that provides different amounts to different types of employees. But again, those types of employees have to be based on the classes. So you could have one amount for full-time, one amount for part-time, one amount for full-time employees covered by a particular collective bargaining agreement, another amount for full-time employees covered by a different collective bargaining agreement. So you could really provide a lot of different reimbursement amounts here. And there are a few more examples I won't spend the time to go through, but you can read after the presentation. I do want to note that there is a notice requirement. So this is a new notice requirement. Participants must receive a notice explaining how the HRA impacts eligibility for the premium tax credit. That notice has to be provided by the date the HRA first becomes effective for the participant and at least 90 days before the beginning of the plan year. We do have a model notice. It was provided in the email this morning and also here on the web feature, but it is not required. You can use it, you don't have to use it. But the notice is not the only notice obligation that an ICHRA would have. As we mentioned, the ICHRA is a group health plan. It is an ERISA benefit, so it must provide a summary of benefits and coverage, and it must provide a summary plan description. The content of the notice I've listed on this slide. There's a lot of content that needs to be in the notice, which is why that model might be helpful. And as far as method of delivery for the notice, the ERISA rules do apply. But interestingly, the regulators in these regulations said that the safe harbor is not the only method by which electronic distribution can be compliant. So if an employer can demonstrate that electronic distribution is reasonably calculated to ensure actual receipt, even for employees that don't have access to the computer system as an integral part of their job, that will satisfy these rules. And the notice can be combined with other materials. And then to take just a minute to talk about opt-out, as a reminder, the ICHRA is minimum essential coverage, and so if somebody's in it, they're not eligible for the premium tax credit. So the participants have to be able to opt out annually, but they don't have to be given the opportunity, and in fact can't be given the opportunity to opt out in the middle of the year. So the employer can establish the opt-out periods for enrolling in or opting out of the HRA. And upon termination of employment, either the HRA has to provide that all remaining amounts are forfeited, or the employee has to be given the opportunity to permanently opt out. And if an employee opts out of coverage, any eligible dependents are also considered to have opted out. That brings us then to our requirements for accepted benefit HRAs, which are considerably less than the requirements for the ICHRAs. The accepted benefit HRA cannot be an integral part of the employer's group health plan, which essentially just means the employer must offer other traditional group health plan coverage. It can't be just accepted benefits or another HRA. It's got to be a major medical coverage. Now, the participant doesn't have to enroll, because remember, we don't have to apply all the integration rules. We don't have to confirm that the participant is in any group health plan. We just need to make a group health plan available to that participant. And the HRA is limited in the amount that it can credit to an individual. It can't be more than $1,800 for a year, and that amount will be adjusted in the future. Amounts made available to a participant under multiple HRAs will be aggregated, so it's not like an employer can offer multiple $1,800 HRAs to the same individual. And that $1,800, like the medical FSA, is based on the amount newly made available. So funds carried over are disregarded. And they are supposed to announce adjustments early in the year, like they do for HSAs, unlike what they do for medical FSAs. So we should have that information in plenty of time to plan for enrollment materials for a calendar year plan. Now, the accepted benefits HRA can't provide reimbursement for premiums or certain health coverage. So can't provide reimbursement for individual health coverage, group health plan coverage, or Medicare. Can provide reimbursement for individual coverage that consists solely of accepted benefits. So again, our cancer-only insurance, our hospital indemnity insurance. Can provide reimbursement for short-term limited duration insurance, unless HHS indicates otherwise in guidance. Can provide reimbursement for COBRA premiums, and for any other coverage that wasn't explicitly excluded. And the HRA must be made available under the same terms to all similarly situated individuals. So this is the standard that we're used to under HIPAA, which means we can't discriminate on the basis of health status. But we also can't discriminate in a good way. So we can't give greater amounts to a person with cancer, or we can't offer the HRA only to people who fail a physical examination. Although we typically can be more favorable to people with health conditions, we can't under an accepted benefit HRA. And enrollment cannot be conditioned on waiving the traditional group health plan. That takes us to the end of our prepared presentation, and I have not seen any questions come through. If you do have questions at this time, please feel free to send them via chat. If not, then thank you for your time. And if you have any questions, you're welcome to email me or Diane Weber at the information you received earlier. Thank you.